Morning. I'm Gordon Smith, the state's director of Opioid Response. It's my pleasure to welcome you to the second webinar in what we call the Governor's Opioid Response Summit Seminar Series. We'll be talking today about the new spike alert texting system that's available to the public. I wanted to talk about a couple of housekeeping things and then mention one other area. As you can see, I'm outdoors today next to the beautiful Machias River and in beautiful Washington County. If you haven't been here, you need to come. I wanted to comment briefly on the announcement earlier this week from the DEA regarding counterfeit and fake pills and the observation offered by DEA Director Milgram that 2 out of every 5 of these pills, which we have seen in Maine, contains at least 2 milligrams of fentanyl, which is considered a deadly dose. So a campaign has been developed around the theme of one pill can kill. And the DEA's done a good job to get these materials out. We'll be getting some out and around the state, try to get some public service announcements, but it is a scary thing. And I talked to Director McKinney at the MDEA earlier this week to see what our experience had been in Maine. Excuse me. And there's been, as early as last year, we've had 3 or 4 seizures that were marked as counterfeit pills that were found to have fentanyl in them. So just, again, a cautionary tale, pass the word. Take some of our materials and talk to Erica Farnsworth at the DEA. And it's just another thing to be concerned about. I also want to remind you that we have another Take Back Day, October 23rd, Saturday. So work with your local law enforcement people and let's get this stuff out of the medicine cabinet. And we always in Maine seem to, it's I don't know whether it's kind of a double whammy. It's good that every year, every Take Back Day, Maine seems to lead New England in the most drugs, the most pills brought back in, which is a good thing, but it's a bad thing that we've got so many to start with. Today, I'm going to introduce our speakers in just a moment. If you have some questions, I'd like to have you put them in the, I don't know that it matters whether they're in the question and answer section or in the chat room. Do you remember, Josh?
Yeah, we would prefer that you would put it in the question and answer chat, okay. The Q&A.
All right, so put your questions there. Some of them we'll answer immediately. Erica Farnsworth is apparently on our webinar today, and she already in the chat room put in her address for the materials. Thank you, Erica. So we'll answer some of the questions as we go along. I'm going to answer. There's some excellent slides, and they're all consolidated into one presentation. So I'm going to introduce all 3 speakers at the same time, and then you'll be rid of me until the very end, and then I'll come back and host a question and answer session to complete the hour. If we don't get to all the questions, as usual, we will answer them all, and they'll be put on the AdCare website. The proceeding will also be recorded and will be available to anyone within a few days. So we're really fortunate today to have the 3 best people to talk about the spike text alert system. On the state side, we have Sybil Mazerolle, and Sybil is the Substance Use Disorder Program Manager for the Office of Behavioral Health and has been part of the Office of Behavioral Health team since the fall of 2017. She's been in other previous roles with the state prior to that time. In her present role, she oversees implementation of several programs, all of which are really important in our opioid response work, including ODMap, the Schmidt Institute's provider case review process, and most recently, the very, very important options liaison program. I would call to your attention that there's a terrific story about our liaison work on the front page of the Bangor Daily News today, featuring Adam Perkins and the work that they're doing in Penobscot County. Sybil has a bachelor's degree from the University of Maine and is currently also pursuing another advanced clinical degree. She is joined by our friends from the Partnership to End Addiction, Kevin Collins and Elizabeth Mustachio. Kevin is the Vice President for Family and Community Support Services. He oversees in that capacity many of the organization's family services programs, including online resource development, a national phone and digital helpline, help and hope by text and parent coaching. And he also directs community engagement initiatives, including DEA 360, which is a multifaceted demand reduction program developed by the DEA. We're very familiar with DEA 360. Before joining the Partnership to End Addiction, Kevin worked for the Partnership for a Drug-Free New Jersey as their Director of Media and Community Relations. He also was a captain in the U.S. Army Reserve and was deployed to the peacekeeping mission in Bosnia. Thank you for your service, Kevin. And he was also staff director for a member of the New York State Assembly. He earned his Bachelor of Arts degree in History and Political Science from Rutgers University, and also completed courses through the United States Army. He's joined by Elizabeth Mustachio. Kevin today joins us from New York State. Elizabeth Mustachio is the Associate Director of Helpline Operations for the Partnership to End Addiction. She's responsible for managing administrative aspects of the organization's helpline operations, which include staffing assignments, maintenance, monitoring of schedules, and attendance records. She's a graduate of Wagner College with a Bachelor of Arts in English and a minor in business marketing. She also holds a master's of business administration, also from Wagner College. It's a great service. We want more people to sign up for it. I am signed up for it myself. They're going to make it easy for you by telling you exactly how to do it, what it means, how it fits in the context of our other work. I've already forgotten since yesterday who's going first, but I think it's Kevin. It's Kevin, and then Elizabeth, and then Sybil, and then I'll be back with you to do questions and answers. Thanks again for being with us. Kevin, take it away.
Super, thank you very much. Okay, if you just want to, okay, we're going to start out by talking a little bit about who we are. So next slide. So we are a 501c3. We're based out in New York City, but we operate nationally. We're the result of a merger between the Partnership for Drug-Free America, probably best known for its public service announcements, and the National Center on Addiction and Substance Abuse, or CASA, which has really did a lot of groundbreaking work and research over the many years that they were operated and led by Joe Califano. The bottom line is that we help the helpers, and we help the helpers help better. We partner with families, professionals, organizations, and really we're at the goal of ending addiction in the nation. We have a public health approach rooted in both science and compassion. All the services we talk about for families are free of charge. Next slide, please. And how we support families. Next slide. You can see this kind of little grid here, which kind of displays. I'm going to go through each one of these one by one. So next, please. So what each program offers, the helpline, it is a national program. It is bilingual in both English and Spanish. And while we do have phone, we've gone far beyond that. What we really try to do is provide families who are seeking support across the spectrum of issues with the various means of connecting with us, whether that's by text, Facebook Messenger, scheduling a phone call, whatever way is going to be most convenient for them. It's not a crisis line, but what it is a place where families can go with questions, anything from my kid's turning 12, I know I need to have the drug talk, I'm not sure what to say, to, you know, my kid is 52 and they've been in and out of treatment for years, and I really, you know, they're now in recovery, I'm trying to support their recovery, what can I do best? Parent coaching is a program that's really near and dear to my heart. It is a program where we have trained volunteer peer parent coaches, all of whom have lived experience as a parent of someone who may have been struggling with substance abuse. Some of our parent coaches have lost children. Some have kids who are in recovery. Some have kids who are still using. But the way the program is set up is that we train a number of these volunteers so they can then provide support to other parents. That is all that support happens over the phone. So it's kind of set up to be remote in the first place. It's also time limited. So there's usually about 5 calls over the period of about 6 to 8 weeks. When that coaching is done, the parent who's seeking support, if they wish, they can go and work with another coach. But again, it's a program that we're really proud of, where we're able to build in that peer support. Next slide, please. We have got Help and Hope. It is a messaging program, really trying to provide messages via text that can be helpful, really trying to provide information that is helpful to folks and also hopeful. It's really trying to get parents, and this is a really stressful situation for a lot of parents across the continuum, from prevention all the way up to treatment and recovery. It can be a really stressful situation for a lot of families. We're trying to provide hope as well. So the way that people can sign up for Help and Hope is by texting JOIN to 55753. They can also sign up via the Spike program, which we'll talk about a little bit later. But again, it's really what the Spike program grew out of is this real help effort to try to provide information to families directly via text. We've got a community education program. Turnkey community educations on opioids, parental communication. We've been very thankful to have the participation of DEA through the DEA 360 program and AdCare of getting some community presentations out in Maine. So again, it's this is again just another way in which we're getting information out to the community. Next slide. We've got our online support community. Again, it is a program that really blends skill development along with support on coping with loved one substance use. They're essentially Zoom meetings. We have 4 of them a week now. We expanded the program when COVID hit, so the program has really been growing. We were just next month, we're going to be launching a program for families who have a loved one who is LGBTQ, so really providing support to those families. We're just piloting a grief program right now as well. So again, it's a great way, especially as everyone is remote and may feel detached from their existing support networks, to try to provide additional support to people. And the last piece I'm going to talk about is e-learning. It's a free online 10 lesson parenting skills program that parents can sign up for, go through, and it really provides great baseline of information that parents can use to help their child, but also help themselves be healthier as they're working through these issues. And again, just wanted to provide this background of the work that we do in the family services space, because it does tie very directly to the work that is for our pilot Spike program. And I'll turn it now over to Elizabeth to talk more about that program.
Awesome. So thank you, Kevin. So as Kevin mentioned, I'm going to talk about the Spike Alert program specifically and sort of why this is important for the state of Maine and sort of some of the progress that we've seen so far. So just to give you all just some background on, how this came to be. So many of you know, like Spike Alert notices, they're distributed to the media, but then they'll decide whether or not they want to cover them. And in many instances, when they do cover these alerts, it's very sensationalized. And as you know, that's not particularly helpful to families or to parents or, people who need to know about these alerts happening in their community. So basically our goal with this program is to ensure that this, free direct ODMap data is sent directly to families and community members via their phone, and also that these alerts are sent to really anyone in the community that can benefit from knowing about a local spike. And then this is supported by a grant. So you can see the name of the grant here. To shorten it, it's called the Kugli Grant. And then I just wanted to talk a little bit about how can Maine specifically help and why this is important in Maine. So as you all here know, Maine was really selected because there's definitely a pronounced need. Overdose is a big problem in Maine, and the overdose rate right now is the 12th highest in the nation. So what we really want to do is use Maine as a model for future expansion of this program, so we can go, county by county and, give this to people and counties that really need this. So eventually we would like to see, the overall national expansion of this program. And just to give you guys an overview of like where we're at right now with the Spike Alert by Text program in Maine, we have 418 subscribers. So obviously that's a good number, but it can definitely be higher. We want to get this in the hands of everyone in Maine that could really benefit from knowing about Spike Alerts. And we've had about 15 alerts go out. So you can see there, that's a lot. That's a very high number. So now I'm going to go into like just the marketing efforts that we've done, and I've broken it up into these 4 categories here. So I'll talk about advertising, media coverage, the marketing collateral that we've created, and some new technology that we would like to roll out. So the first piece is advertising. So we're doing a lot of digital advertising for the Spike program. We have created social media ads that have been tested, and they've been run on the 3 channels you can see here: Facebook, Twitter, and LinkedIn. And for Maine specifically, our campaigns have reached over 51,000 people. So a lot of eyeballs. And we currently have, as I mentioned, 418 enrollments in the program, and 88 out of those enrollments can be attributed to this digital marketing specifically. And then on this slide, we just want to show you like when people sign onto their social media sites, like what does the ad look like? Like what are they seeing? So you can see here, we have an image of 2 people, looking at their phone concerns. And then we have the directions, how to sign up. And it's super easy. You just text Spike to this number here, 855-9OD-NO. So just some next steps, as we've done, all of this digital marketing, like what we're thinking of, for upcoming marketing efforts. So we want to create a customized landing page on our site, specifically for people in the state of Maine. And then we want to look into more Maine-focused digital and non-digital sort of like marketing tactics. So possibly advertising on Spotify, which is very popular, podcasts, maybe exploring a local creator sponsorship, or advertising on Reddit. So now for the media coverage. So we've gotten really fantastic media coverage for the Spike program, picked up by a lot of really great outlets, as you can see here. So this is just a little, preview of some of the outlets that have picked this up. And then the next slide, I've, listed them all out. So, we're just very appreciative to all the reporters and outlets in Maine that have, covered this story and helped us get the word out about Spike. So then I'm going to talk about marketing collateral and what we've created to sort of get out there and get people to sign up. So right now we have a poster, we have a business card, and we have a flyer, just a preview of these that you can see here. And if you look at all these, you can see they all have a QR code on them, which you can scan. It'll bring you right to your text messaging app with Spike already written in the box, the messaging box, and you just click send, and then you opt into the program, fill out the assessment, and it's that simple. You're enrolled in Spike. So this is just some of the stuff and what it looks like. We just wanted to give you an idea of that. And then in this next slide, I'll give everyone like a minute, because you can scan this. If you want to hold your phone up to your screen now, you can give this a little scan and enroll in text if you have enroll in Spike if you haven't done so already. So I will give you all about a minute and then I'll get right back into the presentation.
And Elizabeth, this might be a good opportunity just to say, this is a pilot program and we're learning a lot as we go through. And, one thing is that there's a couple steps when you do sign up for really anything by text. And the first is that you need to agree to receive text from the sender. So you need to say yes to that first step. And then after that, there is a brief survey we ask people to complete, which indicates one, where you're at. So we know how to geolocate the text and make sure that you're getting the right notifications for your area. But secondly, the ability to identify what kind of subscriber you are, whether you're a parent or a community member, health professional, et cetera. So one thing we're learning is trying to get people to complete all of those steps so that they are getting the messages appropriately.
Right. Okay, so I'm gonna move to the next slide, but please let us know if you need us to send you anything so you can sign up. And then this slide is just a recap of everything I just mentioned. So this is the 3 items we have with QR code, so people can sign up. And we are distributing these pieces of marketing collateral to local organizations and community groups so that they can either distribute it, digitally, or they can print it out, possibly include it at an event or in a packet or something like that to encourage people to sign up. So just the last thing I'm going to talk about is just some new technology that we're currently rolling out to help, sort of increase signups and reach as many people as we can. So basically the idea we have right now is making this program accessible to employers. So we basically want to approach, local Maine employers, ask if they'll basically forward the spike alerts to their colleagues, to their staff, through their own email system. And as I mentioned, we want to do this because we feel like it'll expand the reach, get, the alerts out to more people, and act as, additional promotion for people to sign up by their phone. So this technology is developed, it's ready for employers to sign up. And the great thing about this option is that it's super flexible. It's a good fit for any type of organization. There's really no strict criteria. So I've just listed here like some organizations in Maine that we really feel could benefit from this. So like maybe a college, ship iron yard, physical labor jobs, the fishing industry, any sort of like large employers, 50 plus or, more employees that can help us, reach a lot of people, or like employers, with employees who are actually, struggling with substance use themselves. And then sort of how this will work. So as Kevin mentioned, you have to self-identify when you're signing up for Spike and say who you are. So we typically have the 4 options that Kevin just mentioned, but now we've added this 5th option where you can say you're a business owner, employer, or manager. And the only difference with this piece of it is if you sign up as option E, you just have to include, how many colleagues, staff you have that you're gonna, forward the alert to, and you would sign up by email because you're gonna get an email about the alert rather than a phone message. And then finally, we just want to show you what the email will look like, because it'll obviously look a little bit different than the text message because we do include some additional information. Specifically, we include, how to receive, if you want to receive the alerts directly to your phone, you can just text Spike to the number so you can get signed up by your phone as well as get the email from your employer. And so I'm going to pass this over to Sybil now.
Thank you guys so much. So I wanted to talk a little bit about why we launched this Spike Alert text program in Maine and why we were approached by Washington, Baltimore high intensity drug trafficking areas, which is WB HIDA, why they thought that Maine would be a good fit to launch this on a statewide basis. 2.5 years ago, the Office of Behavioral Health partnered with the Department of Public Safety and a technical assistance team to implement the ODMap utilization by law enforcement agencies. ODMap means Overdose Mapping Application Program, and it is a nationwide data repository for public safety, first responder agencies to enter, capture and enter both fatal and non-fatal overdoses, as well as naloxone utilization, all in real time, which these were not data points that we had in real time previously. To date, we have 90 law enforcement agencies signed up to utilize ODMap and sending in overdose data. However, we didn't just want the data, we wanted a meaningful action to follow. So about a year ago this month, the governor announced the options program, which is overdose prevention through intensive outreach, naloxone, and safety. And it essentially outlined a network of behavioral health clinical liaisons that would be embedded with and partnered with public safety and first responder agencies. Coupled with that is a robust public health campaign that can push information out to individuals in the state that are struggling with substance use disorder and those that care about them. The website, knowyouroptions.me, it is embedded within the Spike Alert text message that you would receive if you do sign up for the text service. The message that you get It looks a little bit different depending on which county you're in. But for example, for Kennebec County, where I'm at, we see that the message is the central Maine region is experiencing an increase in overdoses within the last 24 hours. If you or someone you care about is struggling with substance use disorder and would like information on how to access naloxone kits or find a behavioral health liaison to connect you with services in your county, please visit. And then the hyperlink that they provide will take you to the knowYourOptions.me website. The text messages are triggered when 3 overdoses have been entered into ODMap within a 24-hour period in any of the counties. If you are receiving the text, it means that that spike is occurring in the county that your zip code is associated with. By tapping the hyperlink, this is the landing page that you will see. If you go to the About section, and you can go to next slide, Elizabeth, thank you. If you go to the About section, you can get information about the options liaisons. So the top photo that you see, if you click About on that landing page, you will get to the options liaison section. If you do have any questions about the program, my email is on that page, but you can also find the email for the options liaison assigned to your county. If you're looking for resources in your county, you can hit the resource tab, which will take you to where you can filter on the type of service by the county that you live in. So that will give you information on naloxone distribution in your area, recovery supports in your area, treatment, and any of the harm reduction services overseen by our partners at Maine CDC. So right now, you can go to the next slide. We have 14 liaisons on the ground in as many counties. There are 2 counties that remain, and they are in the interview process right now. So that's very exciting. And we look forward to being able to say that all 16 counties are covered. In less than a year of implementation, this new workforce has been able to achieve the following. Next slide. I will have to say over for all of these data points because the information that we have in this is to the end of August. We will receive the data coming from September in the middle of this month. But we have seen over 386 calls co-responded to. That means the liaison arrived at an overdose scene with law enforcement, but separately, so that they're able to stay if the individual would like some additional support. And then we have over 389 post-overdose follow-ups that have been conducted. And like Gordon said, there's a fantastic article in the Bangor Daily News today about our liaison, Adam Perkins, who works in Penobscot and has been doing a fantastic job. Next slide. We have handed out or distributed 645 naloxone kits. And I should say more than, but we have been able to get 645 naloxone kits out into the community in the hands of the individuals that need it. Next slide. For referrals, so these behavioral health liaisons, they do provide referrals to a plethora of services as well as assistance in filling out Medicaid applications. So they've been able to connect nearly 250 individuals to recovery support services, about 220 individuals to longer-term community-based treatment. Slightly less than 100 individuals have been connected to a syringe service program. A little over 50 have been referred out for infectious disease testing like Hep C and HIV. We've been able to help fill out or complete nearly 50 Maine Care applications so that individuals can be covered by the Medicaid expansion that has been implemented at our Medicaid office, and a few referrals to the Maine's maternal opioid misuse program as well. Next slide. Out of the referrals provided to treatment, we have had at least or nearly 200 individuals that have engaged with the provider, their treatment provider, at least one time. Next slide. In the month of August alone, we have seen 52 co-responses, 72 post-overdose follow-ups, 226 naloxone kits provided, 38 proactive referrals received, This is very key because these liaisons don't just have to arrive or show up or do a post-overdose follow-up around overdoses. They can receive proactive referrals from law enforcement, from EMS in their county, from any of the treatment providers. When those individuals have recognized that somebody is truly struggling with SUD, they can refer them to the liaison for some proactive outreach and support. 30 individuals have self-referred and connected with the liaison in their county. 18 training sessions were completed. These liaisons also do some trainings for our first responder community, as well as some of the community-based organizations, to include a fishermen's group in the Mid-Coast area, which I thought was very impressive. We've had 40 referrals to treatment, with 20 at the time engaging at least once with their provider, 38 connections to recovery services, 11 connections to syringe service programs, 10 referrals for infectious disease testing, and 3 individuals in need were assisted to complete a Maine Care application. And while we are still working to grow and strengthen this program, I have to say that I am incredibly proud of the work that's happening on the ground, because we would not be seeing these numbers without it. The inter and intra-departmental collaboration from the recovery and housing team within my office, who has worked extremely hard to expand access to housing for those that don't have it, and that offer or expand the recovery support services. They have been incredible partners on this. And then we have the treatment team, my team, that has been working on increasing low barrier access points to MAT, as well as increasing community-based treatment options, which is so entirely important when you're talking about engaging an individual with an intervention and then moving them on to longer term supports. Maine Care with the maternal opioid misuse project, providing support to pregnant and parenting women, and then integrated care models that Maine Care oversees for OUD, that has been incredibly vital. CDC's SUD prevention team and their community coalitions, which we've been able to make a linkage with for assistance and trainings on the local level with their options liaisons. And then the harm reduction team at Maine CDC that oversees those syringe service programs. Their help and support has been incredible. We have DPS, who has provided a lot of support, both the commissioner as well as the director of EMS, and support in growing this by messaging it out to local law enforcement agencies and EMS providers. The governor's office, Gordon, has been in touch with these liaisons on a personal level. He believes in the work that they're doing and provides them a lot of support. We also have an incredible technical assistance team. It's the same one that was helping law enforcement agencies with the implementation of ODMap, but now they're providing not only that, but the support and information to liaisons so that they don't feel kind of like a lone island in their county. We're bringing them together. They have monthly coaching calls. We have an opportunity to sit down each month, listen to some of the struggles that they're having to serve individuals, and providing them on ideas around how to address those barriers. And then all of the individuals on the ground working in harm reduction, treatment, and recovery, without the partnerships that all of these individuals have provided to us and the liaisons, we would not see the numbers that we're seeing now. And of course it is growing, but this is an incredible amount of work that has been done during a pandemic, launching a new workforce and helping to connect all of these other important state government initiatives that have been launched to help support individuals with SUD. And I think it really shows that Maine knows how to pull together and address very difficult and daunting issues. And so with that, I'm finishing my portion of this, but I do really appreciate the opportunity to work with Partners to End Addiction, and recognizing that once we send that message out, it does have the ability to connect people with real treatment and real recovery services, and an individual to help you navigate an incredibly challenging specialty care system. It can get confusing, and having an ally on your team can make the difference on your success to down the pathway of recovery. So thank you.
Thank you, Sybil. We have quite a bit of time for questions, and we do have some questions. Kevin, this one is addressed to you. Kim was interested in the programs that you were talking about that the partnership offers, and whether there's a website that a summary of that information is available from. I'm guessing that there is. Could you tell us the address? You're muted, I think.
Sorry about that. If you just go to drugfree.org, right on the top, there is a button that says Get Support. I believe it says Get Support. But if you click on that button, it will bring you to a page that shares all of our the helpline, all the other supports that we provide. So it's definitely accessible from our website. And if anyone has any challenges connecting with that, please feel free to reach out to me directly, and I can put my my email in the chat. So
great. Karen has a question that I wanted when I signed up myself, and I don't know the answer to it. I'm hoping, and I suspect that Sybil or Elizabeth or Kevin do. The question is, can you sign up for the spike alerts for other occasions? Meaning, I live in the central Maine area in Kennebec County, so when I, obviously based upon my information that you put in, I get the reports for central Maine. Is there a way that I could have asked for all the alerts in the state, for instance, or a different county than the one I live in?
I'll defer to Elizabeth, who works on this day to day, but I believe the way we've got it set up is that it is tied back to the zip code that you put in, so that it is plugged in, so you would only be receiving them for your area. But again, this is a pilot program, and if that is something that people have interest in, of to check a box to say, yes, I'd like to receive notifications from my whole state, that is something that we could do as we certainly hope to move to a phase 2 of this. So yeah.
Yeah, people are saying they'd like to enter more than one zip code. The way that the pilot is set up right now, you can't enter more than one zip code.
That is correct.
I mean, I think, I don't want to suggest an end run, but if I was really interested in, say, which I am in Machias, where I am today, but I've signed up for Senate Maine, I would probably talk to my, a friend up here and use their address and zip code.
Yep.
And sign up for them, sort of,
yeah,
with my name. So the question was, how do we access the recording for this program? Ryan from AdCare is going to answer this question, or put it in the question answer or the chat. Ryan, can you hear me?
Yes, I can.
Can you tell people how to access this recording? I know it takes a few days after the program.
Yep. Actually just sent that in the Q&A, and they will be out Monday.
Great. My friend Charlie Osborne down at Deer Isle has asked a question for Sybil, but it just disappeared from my screen.
I can see it, Gordon.
Okay.
What he's asking is, according to Maine state data, law enforcement is involved in less than 10% of total overdoses. EDs and EMTs are involved in 75%. Are there plans to have EDs and EMTs contribute to ODMap? So we are working right now. We do have some grant funding to get the EMS data into the national map or into the ODMap system. We've gone through a lot of barriers with this, but the last hurdle that we needed to jump was getting approval from the board of EMS in order to utilize that data and put it into the system. That was approved. So I know that Sam Hurley, director of EMS, and his tech team are working on that right now to transfer the EMS data into ODMap. The EDs are reporting agencies, so they technically could sign up to utilize ODMap and put the information into the system. We haven't focused on that quite yet, recognizing that they're a little bogged down with some of the, issues with the pandemic, but that is something that we could package later on down the line when things have calmed down a little bit. But the EMS data will be put into there relatively soon.
Yeah, I don't want to confuse the answer, Charlie, but we do receive the ED information and the EMT information and information from 3 or 4 other sources, and that is what makes up the monthly overdose report. And so it isn't that we don't have that data, it's that they're not in real time putting the information into ODMap at this point. Have I said that right, Sybil?
Yes, you did.
Okay. And I remind all of you that we now put the monthly data for both saves and fatalities on the mainedrugdata.org website. We don't necessarily put out a press release. It goes in usually about the middle of the next month. So I know August is there, September will go in a couple weeks, and we continue to have a pretty high plateau of fatalities. Unfortunately, we also have dozens of saves for every fatal overdose. And but the reports are great. They're prepared by the University of Maine team, and that website is Maine, as in the state of Maine, MAINE, mainedrugdata.org, and that's operated by the university, and it not only has the overdose data, but it has lots and lots of other data, and our data sharing committee that was referenced earlier in this program meets every month to consider additional types of data. We really haven't put in on there a lot of treatment data yet, and we're getting to that point. And then we're going to look at criminal justice data, and we really haven't yet put in much law enforcement data in terms of seizures, what drugs are being seized, and arrests and prosecution. So it is the definitive place where we intend to put all that information. While we're on it, and we're not out of time, I will mention that the overdose review panel that was established in LD 1718 and got all the appointments made, finalized about a week ago, and had its first meeting this morning. They did not, the 16 members on the panel, they did not, it's a mix of treatment providers, law enforcement, harm reduction, policy people. I think if we spent quite a bit of time with people introducing themselves to one another. There's also people representing people in recovery. There's people representing families that have lost a loved one. So it was really important that people get to know one another. They don't necessarily all work together. And so it was all process oriented. They were welcomed to the panel by the Attorney General, Aaron Fry, who spent the whole 90 minutes with us. And we discussed how the cases will be reviewed. We're one of the few overdose review panels in the country that can look at not only mortality, fatal data from the Attorney General's office, from the Chief Medical Examiner's office, but we also can look at saves. We can look at non-fatal overdoses. And so we've been trying to pass that bill for 2 years, and finally got signed and passed and signed into law by the governor in June. And it was really very exciting this morning to have the 16 members there. And I think you would have been quite impressed as they went around the table, introduced themselves to one another. Well, the virtual table, because we are meeting virtually the first Friday of every month so far. And we intend to meet monthly going forward. The next meeting is November 5th. So there's a question from our friend, Dr. Lamke. Is the Maine State Chamber of Commerce a potential partner in getting the word out? I'll toss that to Sybil.
I would say yes. And Mike, if you'd like to reach out and send me an email, I'm more than happy to send you on any of the materials that you might need for the Maine State Chamber of Commerce, especially around the employment piece that Elizabeth had discussed.
Yeah, with that question, Mike, I don't mind sharing with you that we are being able to launch, at least in some locations, a recovery-friendly worksite initiative that I expect to talk to Dana Connors at the Chamber about. I expect that Dana and NFIB and many business organizations in the state will be very interested in the program that's intended to support people in the workforce already who have a substance use disorder, and also to encourage employers to hire individuals who are in recovery and give them an opportunity. And we've been wanting to replicate the program that New Hampshire has for some time, and we are at least going to pilot it in some counties, including the one I'm sitting in. And we're very excited about that. I do think it can have a role in reducing stigma when you think about the number of people that we need to reach when we do our community forums and movie screenings and all those kinds of things. We tend to look out on the audience and realize that they're really, those 50 or 75 people are with us. That they're already people in recovery, they're family members. They came because they support what we're doing. Some of them will stand up and say, why isn't this auditorium filled? Where is everyone else? It's the everyone else that we need to work on. And we can find them at parents' nights in school. We can find them, and we can really find them in work sites. Nationally, the data shows that of all of the people in this country who have a substance use disorder, that 75% of them are employed. So if you've got, I met with a very large employer recently, and I mean, if you have 1,000 employees, you're going to have quite a few people in your current workforce who have a substance use disorder. And it's just critically important that we change the culture from not telling anyone about it to being able to feel comfortable that you can go to an employee assistance program and not feel you're going to lose your job. And that requires cultural change. And we have some employers who are on the front lines, who are champions in this, and but not everyone. And so now is the opportunity, because there's so many jobs available and unfilled, and yet we also have an unemployed civilian population in some counties that's quite significant. So it's frustrating to have people who aren't working, who would like to, and jobs unfilled. We need to make a better match with that. So there's a question that everybody can see these questions. I assume that Elizabeth is suggesting that there are a few Al-Anon groups that could also use the information from the webinar. I've filled in all I can do today, even though I love to talk. So I'm going to toss it back just to Sybil, Elizabeth, and Kevin, just to make any last minute comments, and then we'll give you back a few extra minutes of your time today. We'll start with Kevin.
I just want to thank Sybil and Gordon and Josh and Ryan and everyone we've had the opportunity to work with. This has been we've learned a lot through this pilot, and just the opportunity to connect with people who are doing work on the ground is really making a huge difference. So just want to say thank you for this opportunity to share the information, but also more broadly, thank you for the opportunity to work with all of you in the state of Maine. Elizabeth?
Great. Elizabeth?
Yeah, so I'll just echo what Kevin said, 100% agree. Thank you guys so much for having us today. And thank you to everyone in the chat that signed up. I saw all those signups. So thank you guys for signing up and helping us spread the word of this, because ultimately we want to save lives, we want to help families, and you guys are all helping us do that.
Sybil, you're carrying a lot of this load. I'm going to let you have the last word.
Thank you, Gordon. Elizabeth, to answer you in the chat, I did provide you my email address. Shoot me an email and I can have the technical assistance team send out some of the information that we do have to provide to the Al-Anon groups. And from there, just thank you so much, Partnership to End Addiction. This has been a very exciting pilot, and it has taken a little bit to get it off the ground, but having it start just at the end of June and to see the number of people that have signed up and the number of spikes that have gone out, I think that speaks to the communication and work that we've done together. So thank you both so much. And thanks, Gordon, for letting us have this time.
Thank you. We'll have another seminar on November 5th. We don't have the topic yet, but we'll send it out in a week or so. And thanks so much to the partnership and for letting Maine be the pilot site. And everybody have a wonderful weekend.
Thank you.